Hello, everyone. My name is Christy Boyd. I'm here with Circle to talk a little bit today about Medicare Advantage. Just do a quick 101 for everyone. I know a lot of you are probably quite familiar with Medicare, but for those of you who aren't, then maybe you can learn a little bit more. So today we're going to walk you through what is Medicare, Medicare Advantage, and their importance in the senior market, specifically kind of focusing on some of the basics of Medicare, what is Medicare Advantage, and the importance of Medicare Advantage in the older populations. So for those of you who don't know me, my name is Christy Boyd. I work with Circle in the role of Senior Vice President of Business Development. So let's talk about the basics of Medicare. It's something that when you think about Medicare, most all of us think, yep, that's something I'll worry about when I'm older, right? We get to 65 and then it's like this crash course in Medicare. It's something you have to learn really quickly, and it's like cramming for the toughest college course of your life. So what can we do to better prepare ourselves and learn about Medicare prior to turning 65? So I want to take you through some of the parts of Medicare and what I like to call the alphabet soup of Medicare. So original Medicare is made up of two parts, Part A and Part B. And if you think about those two parts and really boil them down to their main components, Part A is your hospital insurance. That's the easiest way to think about Part A for Medicare. What that's going to cover for you is your inpatient care, skilled nursing facilities, hospice, and some home health care. Part B is your medical insurance. So that's going to cover your outpatient care, preventative services, and some of your home health care. Those two parts together is what we typically hear when people talk about original Medicare. Now, some of you may have heard of the donut hole of Medicare, and what is that, right? That's your prescription drug coverage, or Part D. Sometimes you hear this referred to as a PDP plan that you can add on to your original Medicare. That's going to be your prescription drug coverage. These are the pieces that most people often think of when they think of Medicare coverage. So when you're helping out your parents, your grandparents, this is what they're most often going to refer to and what they're going to be focused on when they're getting enrolled. But what does enrollment look like? This is another piece to Medicare that can often be really confusing for people. So we all know that when we turn 65, that's the first time we're typically eligible for Medicare. Now, there's certainly exceptions when you talk about people with disabilities and certain special needs, but for most of us, 65 is going to be that window. But what you want to focus on is the 3 months before you turn 65, the month of your 65th birthday, and then the 3 months following turning 65. That's when all of us will be first eligible for Medicare enrollment. During that time, you can enroll for those that original Medicare. So again, going back to that Parts A and B, you can also enroll for a standalone PDP plan. That's the Part D that we just talked about. And that's the first time you can enroll for a Medicare Advantage plan. That's what's known as Part C, and we'll talk about that here in just a little bit. There's additional enrollment periods that will also apply throughout the year for a lot of people. But those election periods, or those enrollment periods, have special qualifications around them. So one of the ones that I want to talk about right now is the annual enrollment period, because that's the period of time that we're in right now. The annual enrollment period runs from October 15th through December 7th, and it's when most of your licensed insurance agents are at their busiest time of year. And your parents and your grandparents are being inundated right now with phone calls, emails, direct mail flyers. And the reason for that is because if you haven't already enrolled for Medicare, it's the time to do it, but it's also the one time of year that you can make changes. And it doesn't require any special things to have happened in your life. You can make those changes, switch from an original Medicare plan to a Medicare Advantage plan, switch back to those plans, make changes in your coverage. So it's a really important time of year for everyone to really take a look at what coverage they have, make sure it fits their current needs, and then make decisions based on those needs. Otherwise, what we're looking at, if you've missed those windows, is the general enrollment period, and then what's called a special enrollment period. So think about times when maybe there's a natural disaster that has occurred, maybe you have some sort of chronic condition that you've recently been diagnosed with. Those are going to be the only other times outside of these annual enrollment periods that you'll be able to make changes in your coverage. So what is now Medicare Advantage? That's the difference between Medicare and Medicare Advantage. Medicare Advantage is what the other letter you hear is known as Part C. So we've got our A, B, C, and D now in our alphabet soup. And what Medicare Advantage is, it's offered by private insurance companies. It is required to cover everything that original Medicare covers, but you're also going to get benefits like dental, vision, hearing, wellness, all of these extras that get included as part of your coverage. You also get more comprehensive and coordinated care through Medicare Advantage plans oftentimes. So it's certainly something when you're looking between a Medicare, original Medicare, and Medicare Advantage plans, it's something to keep in mind when you're thinking about your total health coverage. The importance of this, especially in the older adult population, is because it can really help to simplify their coverage and their health care, right? Now you can get the most cost effective, you can limit your out-of-pocket expenses by going with the Medicare Advantage plan that you wouldn't typically get if you stuck only with original Medicare. And what it really supports, I find, is the health and wellness of our senior population. By going with the Medicare Advantage plan, you're going to be able to take advantage of those vision benefits, those dental benefits, those health and wellness benefits that are not included in original Medicare, thereby getting better health outcomes for the senior population, helping them to stay active, helping them to remain independent. That's what you gain by going with the Medicare Advantage plan. So how can we help better engage with our senior population? That's something that's incredibly important throughout this entire process, is that we're taking a look at our senior population. We're saying, what more can we do? As we all begin to age into these groups, right? We have our parents, we have our grandparents, we're thinking about their health. How do we keep them active? How do we help them remain independent? We want to make sure as these organizations, we're partnering together in ways that are breaking down the silos between engagement and working together in partnerships. So one of those ways that you can do that is begin to explore those partnerships and think about how do we break the silos and instead work together for effective communication. So that's where Circle comes into play. We're an integrated sales, service, and marketing platform for the healthcare community. What we're doing is really taking a member from the time that they're expressing interest in their health and wellness. Maybe they're looking for an online fitness class. Maybe they're looking for that dental benefit. We're helping them overlap that with their health plan, with their provider, and ensuring that where that overlap exists, we're helping them identify the plans, the providers, the agents who live and work in their communities so that they can get that coordinated care that they're looking for. As part of that, we have our program, the InnerCircle, which is connecting the providers, payers, brokers, and healthcare providers directly to those consumers. So now we're not leaving these people to go and figure out those things on their own. So if we think about this, let's say I'm someone looking for a fitness benefit. I want to become more active in my community. Maybe I want to find a walking group. I find that there's a wellness benefit that will allow me to do that. But now I don't know what health plan that benefit is accepted with. Then when I do find maybe a health plan, I don't know if my doctor accepts that health plan, and I don't know if they're going to cover my drug expenses. That's where the InnerCircle comes in. We're going to help coordinate that process for that patient and help them move through the entire process while coordinating with their health plan, coordinating with their provider, coordinating with the health and wellness benefits to ensure that all of those needs are being checked, and then the data is being provided back to each of these groups to say, here's the whole picture of your patient, here are their needs, desires, and here's the ways that you can engage with them to ensure that we're getting better health outcomes. So with Circle, everything is connected. We're a modular platform, so you can have one piece at a time, or you can take the entire platform if that's what you're looking for. Otherwise, we integrate directly within your systems so that we can work to meet your needs as well. So with Circle, anything is possible when everything is connected. And if you'd like to learn more, we would love to talk with you. Thank you so much.